So this video is for lash lift, and we are going to start as if we just got to work. So we would wash our hands, of course. So we'd go to the sink and we'd get some liquid hand soap. We'd wet our hands. We'd wash our hands with the liquid hand soap down to our wrist, and we would wash the back of our hands down to our wrist. We would wash our fingers, and we would wash the back of our fingers. We would wash between our fingers and our thumbs, and between our fingers. We would wash our fingertips and nails. We would wash our thumbs, and we would wash our wrists. And we would do all of that wash, interlocking wash for a minimum of 20 to 30 seconds. And then we would give everything a good proper rinse underneath the sink. When we feel like everything's rinsed off, we would grab disposable paper towels, turn the water off, or a clean towel, and then dry our hands with that, throw it in the trash. If it's disposable paper towels, if it's a clean towel, we would put it in a closed container labeled to be, or not labeled, but just until it's time for laundry. Then we'd find our hand sanitizer, 70% ethyl alcohol, and we would sanitize our hands thoroughly. And then we would get our room prepared for a lash lift. So let's talk about what we're gonna do to get the room ready for our client. So we're gonna disinfect our workstation, bed, and equipment using a disinfectant wipe and following the manufacturer's instructions. We'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll dispense products needed for the service, and we're gonna prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring that the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We'll drape our facial bed using one fitted sheet, one flat sheet, and 3 towels. We'll place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We'll lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. We'll save the 3rd towel to lay across the client's décolleté. Or you can use disposable table paper if you prefer. So we've done all that, and we've got our room ready for our client. So let's talk about what we have here on our tray that is ready to go. So we have some cotton rounds, some 2x2s, and some 4x4s. We have some water. I've got some makeup remover. I've got a little barrier cream that's going to go under the eye pads to help them stay down. So here I have my disposable eye pads. I have my perming solution, my lifting solution, and then I have my setting lotion, excuse me. I've got my glue to hold the lashes to my rods. I've got my rods. I have my little tool to bring the lashes up, my implement. I've got my brushes that I'm probably going to be applying the solution with. I do have disposable mascara wands if I want to use that. I can also, of course, use wooden stick Q-tips to apply to the wand. I've got my gloves because I'm going to be disposable gloves because I'm going to be using gloves for the service. So everything is set up on my tray, ready for my client who is getting ready to come in. And so what we're going to do now is we're going to review our client consultation. So I just washed my hands upon arrival to set my room up. Just so you know, I would always approach my client with clean hands, and then of course I'm going to wash my hands again before the service starts. So let's just talk about that client consultation. So we're going to greet our client and escort them to the work area. We will assess the client's current style. We'll determine the client's preferences and assess the client's needs. We'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products that they've used within the last 72 hours, and then we're going to consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. And then we'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, we are safe to move forward with the procedure, which we are good to go. So we are going to get started. So what we're going to do is wash our hands, but we got to get our client comfortable first. So the client does not have to disrobe for the service. She is going to lay down on the facial bed, and we're going to get her comfortable. So we have a nice little roll of towel here that I'm going to place underneath her head. And then I have a hairnet. And this would be keeping her hair out of her face and away from the lashes, so we can do that. Sorry, my girl's lashes are just a little interesting. And then we have a towel here that we're going to place over her. I'm going to cover her up, like up to the neck, just make sure she's really comfortable, and I don't want anything to go on her clothing or person or self, so we're going to do that right here. And I'm just going to check for one thing to see if I have it close by or if it is available to me. Yes, it is. Okay, good. These mascara ones that I have, disposable mascara ones that I have out, have little balls on the end. I don't know if you could see that, which I do like, but I thought I would also get some that don't. Just easier to comb through if I decide to use those. So just keeping that out of the way. Okay, so we are going to now wash our hands and get ready for the service. So we're going to wet our hands at the sink, and we're going to wash them with some liquid hand soap, about a coin size, and we're going to rub our palms together down to the wrist. We are going to wash the back of our hands down to our wrists. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers and our thumbs. We're going to, of course, wash our thumbs, and we are going to wash our wrist. And we're going to do all of that for a minimum of 20 to 30 seconds. When we feel like we're really clean, we are going to rinse our hands thoroughly underneath the water. When you feel like you've gotten that proper rinse, you're going to find a towel, and you're going to turn off the faucet with the towel or disposable paper towels. If you use disposable paper towels, once you dry those hands off, you can toss them. If you use a clean towel, you're going to put it in the hamper or the area where you put your dirty laundry with a closed lid until it's time for laundry. So then you grab that hand sanitizer, and you're going to pump that sanitizer, and you're going to sanitize your hands. Can you guys tell I've been working all day? I keep mumbling over my words. So just be patient with me here as I work through that. Okay, so we have nice dry hands from our sanitizer, and we want them dry before we put our gloves on. So we're going to put on a pair of disposable gloves. And then we're going to go over to our client. So the first thing we want to do is remove any eye makeup that she might have on. So I'm going to use my cotton rounds and some makeup remover, and we're going to go ahead and take off any makeup. We've also discussed, of course, that she will not be able to be wearing any makeup for a while. We've talked about that before she even came in for her appointment, based on your manufacturer's instructions. So make sure you review that once again, that she's going to have to wait a few days after her lash lift before she can wear makeup. And you just want to make sure you do a really good job here of getting everything off, however many times you need to do that. And then I'm going to make sure everything's nice and dry. And I'm actually going to use one of my disposable applicators, and I'm just combing through the lashes, her lashes right now, before I even start working. And then now it's really important that we protect her. So what we're going to do is we're going to put those eye pads, and we are going to cover up the lower lashes with these eye pads. So I'm going to do a little bit of that protective barrier cream, like a petroleum jelly. I'm going to put a little bit of that on underneath the eye before I put the eye pads on, and I'm just going to literally use a disposable applicator to do that, just because it's going to help that eye pad stick a little bit better and protect her eye area. And so I'm going to be covering up the lower lashes with this one and taking it all the way up on top of that lower lash. So her eyes are going to be closed throughout this entire service until the very end. And I've got my rods here now that I'm going to want to stick down to my client's eyelid. And I don't have, because it's a mannequin, I'm trying to get a little creative on how I would stick it down. Just going to check for one thing. I can hold it in place, but I was just going to see if I have one thing kind of available to me. Some double-sided adhesive here, and I'm going to try this. As an option. To see if it would hold the rod down. And when you are applying the rod, you would want, I don't think it's going to work. Let me try one other thing. It might be that on one side it has the stick, but I'm supposed to peel this other side possibly. And of course, this would be impossible to do with gloves on. Let me just see. I'll just put on a new pair of gloves. I'm just going to see if... I feel like this has a peel side, but maybe not. What I'm going to do is I'm going to take a couple of these double-sideds and I am going to fold them in half to give myself a little bit of a chance here of keeping this rod on her eye. And if it works, it'll be a big success for this video. So imagine that I have gloves on and then I don't need to use double-sided tape for my rods to stick. But I'm going to give this a go. Let me see if I can do this. If I can do this, I'll do the other side, and then I'm going to put my gloves on, obviously, to continue the service, and it would be as if it's a real client. Oh my guys, it might work. Mrs. Piercy, this might work. I'm going to, oof. Let's see here. Even if it's just enough to hold it while I'm working, that would be great. And so now I'm going to put the rod on this side and see. All right, I'm going to go ahead and put my gloves on so that I can press it a little bit better, press it down a little bit better, and work as if in service. So thank you for bearing with me for that. That was just like an emergency. We need to see if this works type situation, because I was going to literally have to hold that rod in place and it was not going to work. And that would have been awful. So nice fresh set of gloves here. Okay. So we have, basically you would take your rod and fit it, figure out your size, and then you would hold it, you know, for 5 to 10 minutes. And then what we're gonna do now is we have our lash adhesive glue, and I'm gonna paint that on the rod and then use the tool that I have to pull the lash up on the rod. Keeping in mind that how I do this is gonna be, will determine how I want them to, when they're on the rod, to look really, really pretty, because how I do this is how they're gonna be during the perming process. So I'm gonna take a minute here to make it look really nice. tape is kind of working, kind of not working. My mannequin's lashes are not that long, so this is a little bit challenging. But as you can see, they are adhering to the rod, which is great. And I'm taking the time to really make them look pretty and not clump together, because and you know, going straight up and down that same direction, because how they do here is how they're going to do when I put that perming solution on, the lifting solution. It's how they're going to be. So I want them to look really, really pretty. Okay, one side is down. I'm going to move over to the other side. The first thing I'm going to do is work on pressing this rod down to, it would already be stuck, but I am using that double-sided tape for my mannequin. So I'm going to make sure here that I give it a good press before I start to do the lash part. Goodness, this doesn't want to stick. But maybe if I start getting those lashes down, it will. So now I'm just going to take a minute on this side to do what I did on the other side to separate everything, of course, so that it is lining up the way I want it to on the rod, because when I do put that lifting solution on, then that's the way it's going to be. So we want to make sure here that we are doing the things that we want to the right way. Nice. So the next step, of course, now is to apply the lifting solution, and we're just going to talk about that for a second. So you always want to follow the manufacturer's directions with everything. I'm going to apply this lift lotion. I'm going to avoid the tips or the very, very ends of the lashes. I'm only going to go 3/4 of the way up the lash. And then I'm going to do the other side. And you're trying to go 3/4 of the way up, but once again, avoid those very ends, because you don't want, that's where it's like the most delicate, that's where it's getting ready to shed anyway, and you don't want to get so close that it's like fry. So I'm just trying to get to the root of the lash. And then 3/4 of the way up. So you would be following manufacturer's directions for all of this. What you would do time-wise here is, depending on the client and the product, 5 to 10 minutes. But you have to note that some clients' lashes will process in as fast as 3 minutes. You just have to be aware of everything. So we're doing a video, so we're going to pretend like this time has elapsed already, and it's time for us to remove the lifting lotion. So what I'm going to do first is I'm going to go with a dry cotton round here. I'm going to remove it, and then I'm going to do damp. So I'm just being really gentle like I would with anything else to remove it. Dry. Always super gentle around the eyes. I'm super gentle everywhere, but extra super gentle. And then I'm going to go damp. So I'm just going to take a little bit of the water. to remove it. Taking off that lifting lotion really gentle, making sure I'm getting it off. And then now you're going to want to put that setting lotion on. So we're going to put our setting lotion on. And then what I'm going to do is I'm just going to take a little second here. Let me grab a little towel that I have right here. Sorry, it's right here. Should have had it a little closer. And all I'm going to do is cover her eyes up. Gently. And I'm going to let her process. And so 5 minutes, we're going to let that lotion sit. And you could have covered her eyes also with the first part if you want to. I will do that on the next video to show you both of those. And then just for the sake of, obviously this is a video, so we don't have to do that, meaning staying here for the time. We're not going to stay for 5 minutes. We will then remove the towel, and it is time to remove that setting lotion. So we'll pretend like 5 minutes has elapsed. So I'm going to do the same concept where I'm going to go a little dry, then damp for the remove, for starting a little dry and then doing a little damp. And obviously because these lashes are up on that rod, you get to go up and back as you're removing, where usually when we take makeup off, you know, we're going down. So we're just going up and back. And then I'm going to go in damp. Beautiful. And then what I'm going to do now is I'm going to take one of those wooden stick Q-tips with a damp end, and it's going to come right off the rod. We're going to be able to take the easy peasy here. We're going to be able to take these lashes right off this rod. I say that. We're going to get some water here to continue to do what I'm doing. And then I'll also be removing that eye pad from underneath the eye, which I'll go ahead and slide that off because we're going to throw that away. And there's nothing here that now on this eye rod or on her lashes that will be harmful in any way. So we've taken off both the lift lotion and the setting lotion. Just using water to simply remove the lashes from the rod. And we're able to remove that rod gently. Being mindful, of course, that we have that tape on her that we would not have on her normally. I'm just combing through her lashes because it has a little bit of that lash glue on it left and cholesterol because of how we're mocking this service, but normally those things aren't on there. So I'm just going to take a second here to comb through and get all this goo off of her that we wouldn't normally have on her. Which I can easily do some more wipe and remover to get that off. So it's just going to show you that your products are everything. Like I just ordered some glue on Amazon to mock it, but this certainly did not happen to her lashes when we used the glue in school. So it's a different brand, and you see the quality is 100% different. Came right off of her lashes with water at school. This is not happening here. So clearly it's not even remotely the same category of caliber of product. And we're going to go to the other side, see how this side goes. Maybe it'll be better. Seems to be going simply so far, although I do see the glue in the lashes. The glue that you use to adhere it to the rod. Rod coming right off nice and gentle off the rod with the lashes. I'm going to take the gentle disposable eye pad off that we're going to toss. And then I'm going to do the same thing where I try to comb through her lashes to remove some of this glue. So if this happened in service, I would be doing the same thing. I would be just as diligent to remove any glue that might be on her lashes if that happened in real time. This side did a lot better than as far as the glue staying on the lashes than the other side. So maybe I just put more glue on the other side, and I'll try to do less next time. And maybe it'll adhere a little bit better. So let me just take another damp white to try to get all the glue off before I show the client how amazing her lashes look. Seemed to help for this side. Let me see if it'll help for the other side. Maybe it just needed more moisture to take it all off. disappointing. Okay, so I'm just going to comb through them one time and finish up, and then I'll hopefully have better results the next time I try. But clearly the glue is of quite a low caliber, and it's just, I know her lashes aren't our lashes, but wouldn't think it would be this bad considering we have used a lash lift glue and at school, and none of this happened with her lashes. And I have gotten lash lift service several times, like 3 or 4 times, and it's never happened to me either. On my own, like person working on me, this hasn't happened. So what a bummer, but at least you get the gist of it. And all I'm doing is I've combed now all the glue out of the client's lashes. And voila. So she's great. And basically what we're going to do now is we would remove our gloves because it's time to get her checked out. So these are disposables. So you're going to take off your gloves, and we'll talk about what we do at the end of this lash lift service. So you will she did not have to change for this. So you're able to take off her linen, you're able to take off of her her headband or hairnet, and you'll be able to take her out. You will make sure that you go over all of the follow-up and after the maintenance and aftercare, because she cannot wear makeup or get her lashes wet 48 hours. So she's got some due diligence there. And then you'll get her checked out and moving on. And then you have to get ready for your next client. So what you're going to do is you're going to go to your room, and you're going to find any single-use items like these guys, etc., and you're going to toss everything in the trash that you need to. That's what I'm doing right now. Yuck, yuck, and a bluck, bluck. Okay, all that stuff is trashola, and it is going in the trash. There it goes. Okay. You're going to find any implements that you might have used, and you're going to place them in a closed container labeled to be disinfected. And any of the sheets, the towels, all of those linens are going to go into a closed container with a lid until it's time to do the laundry. Then you're going to clean your work area and disinfect it. You're going to identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage, wipe down your workstation and area with cleaning solution to remove debris. You're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. You're going to follow the manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You're also going to disinfect electrical equipment and store it in a clean area separate from other implements. Now, to use that disinfectant that is EPA approved for use in a salon setting, you would have had to put on disposable gloves. So those would now be removed into the trash, and it's time to wash your hands. So you're going to wet your hands at the sink. You're going to find the liquid hand soap. You're going to get a coin size, and you're going to wash your hands together down to the wrist. You're going to wash the back of the hands down to the wrist. You're going to wash your fingers, and you're going to wash the back of your fingers. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You are going to wash your fingertips and nails. You're going to wash your wrists. You're going to do all of that wash for a minimum of 20 to 30 seconds. When you feel like you've gotten everything nice and clean, You'll rinse thoroughly underneath the water at the sink. You're going to find some disposable paper towels, and you're going to turn off the faucet with the towels. Dry your hands off, toss the towels into the trash, then find your 70% ethyl alcohol hand sanitizer, and you're going to finish by sanitizing your hands. Then you can begin setup for next client, an appointment that's coming. So that concludes your lash lift video.